Hi, folks. I'm Jake Lacey with US Medicare Group, and today we're actually going to go into what Medicare Advantage actually is and what the potential exposure you could have by going with one of these free plans that probably one of the insurance agents you've actually already talked to has been trying to get you signed up for. Let's dig into what Medicare Advantage really is. Medicare Advantage is essentially just the federal government giving a set dollar amount to the insurance company to provide you Medicare coverage. What happens there is you're no longer involved in original Medicare, so your red, white, and blue card is no longer valid. You might as well just shred that and throw it away. And what you're subject to is the insurance company then has to make a profit. What that means is there's a lot of doctors out there who will accept Medicare, usually a fairly large network. Most doctors will. Once you go on a Medicare Advantage plan, either through like a Humana or someone like that, you're now on the company's network plan. So that could be a very limited network. One of the networks, it could only be in your local area. So if you ever travel, say you're in Florida, you travel up north to Pennsylvania or New Jersey, you may not have coverage in New Jersey and Pennsylvania, whereas you only have coverage in Florida. That's one potential problem with Medicare Advantage. The other problem we have with Medicare Advantage is how it actually operates. So, like I said, it's going back to the insurance company getting a set dollar amount to provide you coverage for the year. Well, the government is happy with that because now they have a set fixed amount for what your care is going to coverage is going to cost. They pay the company, and then they're no longer liable. Well, then it's the insurance company's job to make a profit. The problem we have with that is that a lot of times, for example, say you get cancer, how that works is you're only limited to a certain network of doctors. How those doctors operate is the insurance company's contracted through them. The doctor accepts a low monthly set rate to see as many patients as possible. Then what they're doing is they're pushing through as many warm bodies as possible. And if something's actually wrong with you, say, like I just said, cancer, they'll usually just start doing initial tests. So you may not even know you had cancer. So they'll do the cheapest forms of tests and procedures, just hoping that that fixes the problems and gets you through the door and out the door quickly. Then after a couple months, initially you'll get the approval to get a medical procedure done, and you do say you find out you have cancer. Well, what happens next is even worse, because now you can no longer go to the top oncologist in the state because he may not accept the Medicare Advantage plan. He probably will accept Medicare, but for your situation, if you don't like the actual specialist you have to go see for Medicare Advantage or for cancer, you're stuck. You have to go see that doctor. You can't go get treatment from the top doctor who says, hey, if you have a Medicare or Medicare supplement plan, you go to that doctor, he says, okay, you have cancer. We need to do this, we need to take a test, we need to start chemotherapy right away. We're going to do some x-rays and just get the actual diagnosis starting right away. You actually might be 2 months down the road, 3 months down the road before you actually get to that step. Now in cancer, that's life and death. I mean, early detection and early treatment is the most important factor of you actually having a survival rate when it comes to things like cancer or even heart disease. What's worse, why we really don't recommend it, is what it really exposes you to financially. Most of these plans, now you can look this all up in your summary of benefits, they have an out-of-pocket maximum of about usually $6,700, somewhere right around there, $6,000. Plans have different ones, but usually it's in the $5,000-$6,000 range. And you might think, well, that's not too bad. The problem with it is usually when you get sick, say you get sick in February, or not February, let's say you get sick in October or November and you go to the hospital, you find out you do have cancer or heart disease, or for example, you just slip and fall and you have a broken hip and you're getting physical therapy done. Well, you pay that initial $6,700 out to meet your out-of-pocket maximum. You're going through Christmas, New Year's, not such a big deal. You're all covered. You don't have to pay anything when you go into the doctor. What happens after that, though, is on January 1st, your deductible resets for the plan. So what happens there? You got to come out of pocket another $6,700. So you're looking at $13,200 if you have a $6,700 deductible within a matter of 4 or 5 months. Now, for a lot of seniors, they like to have fixed costs because they're on a fixed income. And for some people, unfortunately, with Medicare Advantage, that is their only option because they just can't afford it. However, the best situation for you, in our experience, would be to go with like a Medicare Supplement Plan F, where you wouldn't have anything out of pocket. Being 65, 66 years old, it might cost you $150 tops. I mean, we shop the network and make sure everything's cheap. Or you can go with a Plan G and only have a max out of pocket for the year of $166, and it might even be $30, $40 less. You could get one at 65 for, depending on your area, between $100 and $120 a month. So then your fixed costs are much, much lower. You know what you're going to go in, and you can go with the top cancer treatment facilities out there that accept Medicare. Your fixed costs might be $100 a month, $200 a month, counting your Part B deductible of $104.95, $250 total. But the beauty of it is, you go to wherever you want. No matter what happens, you're $250 out of pocket a month max. You can actually set a budget. Now, you could hope and pray that basically the Medicare Advantage plan, you won't get cancer or something like that. But I think by this point in your life, even in my life personally, we all know someone who has gotten cancer at one point in their life, and it's not cheap. That's why we never recommend Medicare Advantage to anyone. For the main reason that it ends up actually not being free, limits the coverage you need, and it ends up costing you more if something were to go wrong. Whereas if you just go and have us shop a Medicare supplement plan for you, we can get a very fixed rate for a monthly cost, and you have no out of pocket expenses after that, which allows you to budget properly, sleep easy at night, and we're always here to take care of you to make sure you're paying the lowest amount possible for your Medicare supplement, and you have much more access to the doctors you want to see, and not the doctors on some Medicare Advantage plan that are only limited to a certain area and only a certain amount of doctors, usually not the top doctors in the state or the country, because they went to school to become the top doctors and not take a low rate for their care. They cost more money. That's just what it is. So give us a call or continue watching these videos so that we can actually go through a little bit more detail and write more questions down about Medicare Advantage, about Medicare supplements, Medicare Parts A and B, and we'll go over it on our phone call. I know we have, if you haven't set up a appointment yet with us, please do so. Give us a call, shoot us an email here. We're happy to help people out. We're going to be here to shop for you, take care of you for the rest of your life. Any questions whatsoever, like I said, call the phone number below. We're here to help you out. Thanks.